Do you think your dog is experiencing some neck pain, but you're just not quite sure? Today, I'm going to talk about the different kinds of neck pain, how to assess your dog for neck pain, and things that you can do about it. Welcome to Canine Wellness Online. I'm Tanya Costa, and this is Ben. So, neck pain and neck injuries can be very debilitating and painful for dogs. There's a variety of causes for neck pain, and it's important to get to the root cause so that you can address it in the right way. Some of the causes can be as simple as a muscle strain from running too much or running into something or playing too hard, to vector-borne disease like ticks, or in some cases it can be even disc related. In my office, the most common kind of neck pain that I see is from something that's due to disc issues. So it could be chronic for the older dog, or it could be more acute in some of other dogs. I see a number of breeds like Dobermans, Bernese Mountain Dogs, Shih Tzus, French Bulldogs, just to name a few, that are genetically predisposed to getting disc issues in their spine. And sometimes it could be lower down, or in other cases, it can be higher up in their neck. Typically, with the more chronic conditions in the older dog, it's not an emergency vet visit. It's being able to help them at home, because what happens with these degenerative discs is that, for lack of a better term, there could be some narrowing of the disc space, or there could be a little bit of spondylosis, or for lack of a better word, arthritis, which can cause pain, especially when they do certain movement. The last type is something a little more sinister, and it can be caused by some sort of tumor that's in the vertebrae in the neck. But to be honest, in 24 years, I have only ever seen 2 cases like that. So please don't go down the rabbit hole thinking it's a tumor, because it's very unlikely. So let's first talk about how you can assess your dog's neck. Now, there's several different things that I'm going to show you to be able to kind of get an idea of whether it's more muscular or more disky. So the first test is called the cookie test. So Ben has been waiting for a cookie. What we're going to do with the cookie test is have our dog, he can be sitting or standing. So what you do is you take your treat and you bring it around, and it should be no issue. And compare the other side. You can do it on the other side. Then we're going to bring the treat up, and then we're going to bring the treat down and kind of between his legs. So basically what you're doing is you're assessing his movement of his neck from side to side, up and down. And if you find one side doesn't seem to be able to go as far as the other, then that can tell you, okay, well, there might be something going on that side. And the reason for that is because if we look at our neck vertebrae, if he doesn't want to turn this way, he's closing down and maybe pinching a nerve there, or maybe the muscles in the neck, because they have so many muscles in their neck, it's very hard to actually palpate, but I am going to show you in a minute. But it can be just slightly pinching a nerve. Now, the other test you can do is palpating the neck. Again, can be very difficult because they've got so many muscles in here. And if you watch this video on some myofascial trigger points, one of the indications will be when you start to palpate in here and starting to feel with your fingers, and you may find some trigger points in there, which can tell you that maybe there's a little bit of a muscle issue. Now, having said that, if they're turning their head in every direction and there's no pain, but you find some trigger points, that's kind of telling you it's probably more muscular related. And basically all you're going to do is just kind of feel around and see if your dog reacts at all to any areas that you touch. I wouldn't go down in here. This is for somebody who's more experienced like myself. When I'm assessing, I come underneath and feel the actual vertebrae in the neck. Some of the other things that you might see is some mild to moderate behavioral changes. So maybe your dog isn't eating as well, and that can be because they don't want to reach down into the food bowl, or perhaps they don't want to jump on the couch, or they don't want to jump up onto the bed or into the car. That might be a little bit of a something's going on. Other things could be changes in their gait, which I'll get to in a moment. But if your dog is crying out or whining, especially in the evenings, and especially when they go to turn or do something, that's definitely a red flag that needs to be addressed fairly immediately. Some of the other tests that you can do to test for neurological issues is, one of them is just turning over their paw. So if you turn over their paw and they don't turn it all over right away like that, that can be telling you it might be a little bit neurological. Now, you want to be testing the front if it's coming from the neck, as opposed to checking the back. Some of the other tests that you can do is, one is called a hopping reflex. And usually I do it standing up, but you can do it sitting down. And basically you're lifting the foot and I'm pushing towards the leg that's down. And what should happen is what he just did. He moved his foot over. So if you do this and you push and then your dog falls over, it can tell you that the nerves are not firing the way they should be. Another telltale sign is your dog goes out to play and they seem fine. They have the usual energy. They come home, they go to sleep for a little while, they get up, and then all of a sudden they're walking. Like in this video here, Lena, she came to my office because the owner noticed something was just off. And she had been to the vet and the vet couldn't find anything. But she sent me this video and I looked at it, and it was just after she had gone for a walk and then slept for an hour. And she got up and she has her head down. She's kind of got a little bit of a limp on the front leg and doesn't want to turn her head. So that to me, I was right away, I said, I think this is a neck issue. And obviously when she came here and I palpated the neck and did the tests that I'm showing you, I was like, this is definitely a disc issue. And the reason for this is because what happened is, when they're walking and running and playing and doing all the things that they're doing, and then they come home and rest, they're getting some inflammation and that's causing pain. And so they're holding their head down. So now you've got the test. So what do you do? So let's say that all these tests were normal, but you notice maybe a little bit your dog turning its head to the left side was a little bit stiff. So what you can do at home? Well, first of all, you can do those cookie stretches, but don't force the cookie stretch. So basically what you're going to do is, if it can only go this far, then you go this far and then bring it around the other way and then bring it back this way and bring it back that way and then up a bit. So you're just basically doing some range of motion of their neck to just try and get the kinks worked out, for lack of a better word. The other thing that you can do is moist heat. So I do have a video on that. And basically you're just taking a gel pack or an ice pack that's heated up and wrapping a wet towel around it. And what you're going to do is just place it over their neck, right over here, and just let it sit there for 10 minutes. And what that's going to do is help to alleviate those muscles in the neck so that it can kind of get blood flow there and help relax things. I would also recommend that if you think your dog has, it's a muscle type thing, because all the other tests seem normal, I would also recommend you might want to use a harness instead of a collar for a few days, especially if your dog is a puller. I have seen a lot of little dogs that are active well, even big dogs that are pullers. And over the years, that might be one of the causes of some spondylosis in the neck area, which is causing a little bit of irritation. So if we use a harness, it's not pulling on their neck. And the last thing you can do is just raise the food bowl, because then they don't have to be reaching down as far to get the food. Now, if this does not resolve within a few days, I definitely think you should be going to your vet and perhaps getting an x-ray just to double check things, or at very least have your vet check your dog for any kind of vector-borne diseases like tick, especially if you live in an area like I do where ticks are everywhere. So that's one rule out, to see if perhaps it's a tick-borne disease. So what happens if your dog, let's say, has one or more of those neurological symptoms? What do you do? Well, my advice to you is you go to your vet quickly and not wait a few days. And the reason I say that is because time is of the essence. You want to make sure, especially because number one, you're going to need some pain medications because neck pain is very debilitating and you definitely don't want your dog in pain. And the other part of it is your vet can do blood work and just check to make sure that there's no tick-borne disease that's playing a role into this. They can do an exam as well, and perhaps at the very least do an x-ray to see if maybe there's some narrowing of the disc space that would suggest pinching of a nerve. They can't see nerves or discs in an x-ray, only an MRI or a CT scan can do that. But you may not want to go to DEFCON 5 right away. You might want to just take the first step and allow your vet to suggest to you what the next steps are after that. I hope this video helps you be able to determine or fine-tune where you think the pain is coming from and for what reason. Stay tuned for the next video.